The nonpartisan Wisconsin Legislative Audit Bureau has released its audit of state retiree health insurance reporting for the state of Wisconsin as of June 30th, 2025. This audit was published as report number 26-09 in August 2026. The following is the report summary. The State Retiree Health Insurance Program, which is one of the other post-employment benefits or OPEB plans offered by the state of Wisconsin to eligible retirees, is administered by the Wisconsin Department of Employee Trust Funds, or ETF. OPEB refers to the benefits, other than pensions, that a state or local government employee may receive after they have left employment, generally upon retirement. The program offers retirees who are not yet eligible for Medicare the option to participate in the state's group health insurance program. Premiums are established and collected based on the current needs of the program, and assets are not accumulated to pay future benefits. The Wisconsin Department of Administration, or DOA, is responsible for preparing the financial statements of the state of Wisconsin, including calculating the total OPEB liability for the program. To assist state agencies, such as the University of Wisconsin or UW System, and various authorities, including the UW Hospitals and Clinics Authority, in preparing their own financial statements following Generally Accepted Accounting Principles, or GAAP, DOA prepared employer schedules and notes for the program. We provided unmodified opinions on the schedule of employer allocations of the State Retiree Health Insurance Program, the total amounts in certain columns in the schedule of OPEB amounts by participating employer of the State Retiree Health Insurance Program, and the related notes to these employer schedules as of and for the year ended June 30, 2025. We conducted our audit by auditing the employer schedules and related notes in accordance with applicable government auditing standards, issuing our auditor's opinions, reviewing internal controls, and issuing our auditor's report on internal control and compliance. We also retained an actuary to conduct an independent review of the program's actuarial calculations and actuarial valuation report. DOA reported a total OPEB liability of $842.1 million as of June 30, 2025 for the State Retiree Health Insurance Program. Although the state does not directly pay any portion of the premium for retirees who choose to participate in the program, the state does pay higher premiums for its active employees than it otherwise would if retirees were excluded. Therefore, the state implicitly subsidizes the premiums paid by participating retirees by offering these individuals access to health insurance coverage at a lower rate than they might otherwise pay based upon their age. This, in turn, creates an OPEB liability the state must recognize for purposes of financial reporting. The total OPEB liability for the State Retiree Health Insurance Program increased from $838.5 million as of June 30, 2024, to $842.1 million as of June 30, 2025, or by 0.4%. The actuarial audit made 4 recommendations for improvement in the actuarial valuation. The actuarial audit made 4 recommendations for improvement in the draft actuarial valuation. The consulting actuary agreed with the results of the actuarial audit and implemented 2 of the recommendations in the final actuarial valuation. The consulting actuary indicated it will consider the remaining recommendations in a future valuation. To view this and other publications from the Nonpartisan Wisconsin Legislative Audit Bureau, please visit our website at www.legis.wisconsin.gov/lab. To report fraud, waste, and mismanagement in state government, please contact our hotline at 1-877-FRAUD-17.